drug overall was relatively safe. In the cervical cohort, the most common adverse event was epistaxis, which is nose bleeding. And most of these events were either grade 1. There was one incident of a grade 2 event. Fatigue, I think, was the second most common adverse event that we saw. There were 3 types of adverse events that were of interest, particularly because we anticipated that these were mechanistically driven by TV. One was neurotoxicity or neuropathy, 2 was bleeding events, and 3 was ocular toxicity. The bleeding events, again, most common being epistaxis, all usually grade 1. There was a handful of patients who had vaginal bleeding, but all the investigators and additional review of the data suggest that this was probably secondary to underlying disease, not necessarily the drug. We did see early on in the phase 1 setting incidents of ocular toxicity, mostly conjunctivitis and dry eyes. We implemented a mitigation plan, primarily steroid eye drops, cooling masks during the infusion, and some dose reduction, and that significantly reduced the number of patients with ocular toxicity. I think overall this is a very safe drug relative to just new drugs in development, so I don't see any major other toxicities that will likely emerge in combinations.